Each January, Worcestershire County Council, like many councils, publishes its draft budget. The single biggest line item isn't roads, it isn't education, it's adult social care. £375 million. That's roughly 3 out of every £4 that the council spends. Now, on the 29th of July, just a few days ago, the Prime Minister stood up and said the system is broken and needs fundamental reform. So today we're going to look at where that £375 million goes, why it keeps rising, and what Andy Burnham's new plan actually means for your council tax bill. And because whilst Worcestershire is the example, the same maths applies to every council in England. So let's start with the figure itself, £375 million. That's the gross budget for adult social care and health in Worcestershire for 2025 into 2026. To put that into perspective, the council's entire net budget is around £495 million. So for every pound the council has discretion over, roughly 75 pence goes straight to adult and children's social care before anything else gets a look in. And it's not just Worcestershire. The Association of Directors of Adult Social Services published their annual survey just a few weeks ago. Councils across England overspent their social care budgets last year, the 4th consecutive year of overspending. The ADASS president called it a disconnect between government ambitions and the funding provided to deliver them. So what's driving the rise? Well, 3 things, and they're all structural, not one-off blips. Firstly, demographics. Worcestershire has an ageing population. More people over 65 means more demand for care. Home visits, residential placements, support for dementia. That's not a crisis you fix, it's a trend you manage. Secondly, cost shifting from the NHS. 3/4 of council directors report that increasing numbers of people who would previously have been covered by NHS continuing healthcare are now being pushed onto council-funded social care instead. These are people with the most complex, expensive needs. The NHS budget is already under pressure, so the bill moves sideways, from Whitehall to County Hall. Thirdly, the funding gap. While demand has surged, central government funding for all adult social care has been cut by roughly 40% in real terms over the last decade. I've covered this before on the channel. Councils like Worcestershire are being asked to deliver more care with significantly less from Westminster. The shortfall doesn't disappear, it gets pushed onto your council tax bill through the adult social care precept. Every year, that 2% levy isn't optional, it's structural. And think of it like this. If your household budget is already maxed out on the mortgage and then your energy bill doubles and the roof starts leaking, you're not overspending because you're reckless. You're overspending because the costs you can't control keep rising. If you're enjoying this kind of political analysis, one that looks beyond the headlines and explains what national politics means here in Worcestershire, please consider subscribing. And tell me in the comments, would you be willing to pay more council tax to fix social care, or should the money come from central government? Now, back to what Burnham's plan actually says. On the 29th of July, Andy Burnham gave his first major speech on social care as Prime Minister. He announced 3 things. 1, a new national care service, essentially an NHS-style model where social care would be free at the point of use, funded centrally rather than through council tax. 2, the Casey Review. A landmark report on social care reform led by Baroness Casey will now be published next summer instead of 2028. He's fast-tracking it by a full year. And 3, he explicitly did not rule out tax rises to pay for it. His words, there will be difficult decisions. In his first speech outside 10 Downing Street, Burnham said that he wanted cross-party cooperation. The Liberal Democrats, who have campaigned on social care reform for years, offered to work with him immediately. The Conservatives came round to the idea and joined the talks as well. Now, neither Reform UK nor the Greens offered to participate, and neither were invited. Reform UK currently does not have a health and social care spokesperson, no published policy on the issue, and their leader isn't an MP. A senior Reform figure, Robert Jenrick, has also suggested that had Farage been present, he would have refused to support any policy, and the party has already branded any potential tax increase a death tax, despite no such measure being formally announced. So the practical question for Worcestershire is this. Even if Burnham announces a fully funded national care service next summer, it won't arrive overnight. The The Fair Pay Agreement for care workers doesn't kick in until 28-29, and in the meantime your council tax keeps rising because that 2% adult social care levy is the only tool the council has to plug the gap right now. There's one more factor that makes this especially urgent for Worcestershire and other councils: local government reorganisation, or the unitary reorganisation. Worcestershire County Council is being replaced by 2 new unitary authorities in 2028. The council's own leader has already warned that the new authorities will need more government cash for social care when they take over. The current council is effectively managing a system in transition, trying to balance a budget for services it won't be responsible for in 2 years' time. So the question isn't just how do we fund social care, it's who will be responsible for funding it in Worcestershire when the current council no longer exists. Social care is the biggest single cost on your council tax bill, and the one that national politicians have spent 30 years failing to fix. Burnham's speech is potentially the most serious attempt at reform since at least 2011. But the gap between a speech in Westminster and a balanced budget in Worcestershire is measured in years, not days. If you've enjoyed this investigation, please leave a like. It really does help the channel to grow, and please hit subscribe and drop a comment below. I read every one, and your questions often become the next video. Thanks for watching, and I'll see you in the next one.